Well, we've covered the gamut almost with healthcare. Today we're talking to Dr. Kirk Erickson, who has been in the chiropractic medicine or chiropractic care for years, and now he has added laser treatment to his procedures. Dr. Erickson, it's wonderful to have you back on our show again.
Thanks for having me, Ann. It's great to be back.
You were a guest on our program for years, and you did excellent chiropractic care. You have added the treatment with a laser in the last several years. Explain what you do, especially for something like neuropathy.
Yes, over 20 million people in our country suffer from peripheral neuropathy, and there's many different causes, diabetes being the number one cause. And if you have diabetes, you probably have a greater than 50% chance of developing peripheral neuropathy.
Explain exactly to the non-person,
Yes.
non-educated in that field.
Okay, essentially neuropathy, it usually affects the feet. Sometimes it can affect the hands, but literally the nerves in the feet are degenerating and they're dying. And so it develops into a myriad of symptoms that begin with numbness and tingling. It can develop into burning pain and also feeling like you're walking on glass. And probably the most serious development is problems with balance, because with the elderly patients, when their balance is bad, if they fall, they can break a hip, shoulder, and then the next thing you know it, they're really in serious trouble.
So you now have, with a laser, you've researched it. Tell us how this works, particularly in neuropathy.
Yes, the reason why so many patients come to me with neuropathy is because it's very difficult and frustrating to treat medically. And there's different medications that are given, and a lot of times it just doesn't work, or they have too many side effects. And too many patients are told they just have to live with it. But it's just not true. Likewise, chiropractic care in and of itself, in my opinion, in my experience, is not that effective either. So we have to have a totally different treatment program that involves the laser. We use class 4 lasers. Actually, we have a robotic laser that's used.
Oh, wonderful.
Very sophisticated. As a matter of fact, I woke up this morning and checked my email, and there's a brand new study that just came out in a medical journal on the effectiveness of the laser. There's other studies that have been published. As a matter of fact, every treatment modality we use, we have a plethora of medical studies to support the effectiveness and the safety of these methods. But the lasers, what they do, several things. They not only help reduce the pain, but they improve blood circulation to the feet and helps with nerve regeneration. We use something called pulsed electromagnetic field therapy, which Dr. Oz made famous years ago when he did a whole show on it. But studies that literally show here that it not only helps, again, the pain, can literally regenerate these nerves.
That's what I'm thinking, getting the blood flowing, that would help immediately.
Yes, and there's a handful of things we do to improve the blood flow. Actually, one of the newest things that we added about a month ago is EWOT therapy, which is exercise with oxygen therapy. And basically what it does is it helps to infuse oxygen into the blood, which is so important. We not only want to improve blood circulation to the feet, but you got to have oxygen-rich blood to help nourish the nerves, to help them to recover.
Wow. Even in your practice, there have been so many additions. You just seem to keep going and going.
It's one of those things. It starts off, when I first started studying this in 2015, I never had a lack of interest in helping patients with neuropathy because I couldn't help them. And with just chiropractic care. So I started investigating, and it's one of those things, you get some technology that helps, but then there's a certain percentage of patients that it's not helping, so then you have to get something else to help that percentage of patients. We essentially get about a 40% improvement in the nerve sensory function in their feet when we perform our re-examination for these patients, which is pretty amazing considering this is a condition that's not considered to improve medically for the most part.
What a wonderful gift you could give to your patients. Well, we encourage you to call. There's information on the screen. He's in the same location he has been in. It's now not only Erickson Chiropractic Care, but also laser. Here's the phone number and the website. Dr. Kirk Erickson.